Hey everyone, I am Dr. Missy Albrecht.
I am Dr. Ariana Wenlant.
And we are here with Invincible. We have this massive mission to share the importance of organ movement with the world, and we're super excited to just sit here and chat with you all about it.
So we are both physical therapists. We work at a physical therapy clinic. That's what our office is.
Yep.
And we primarily focus on something called visceral manipulation.
Yeah. So visceral manipulation, we're just going to read the definition for you. This is Jean-Pierre Barral was the man who discovered this work out in France.
Mm-hmm.
Do you remember what year it was?
It was a while ago.
Like early 1900s.
I was going to say, I think his discovery started in 1930s-ish.
Okay.
And then started becoming an actual
modality.
Training or modality in the 1950s, I believe.
So it's been here for a while, and it's just more recently catching traction, I think, in mainstream treatment because it's so amazing.
Mm-hmm.
So just to really briefly read the definition. So visceral manipulation is gentle manual therapy that assesses the structural relationships between viscera, the organs, and their fascial or ligamentous attachments to the various systems in the body. So when we are doing this work with patients, we are assisting functional and structural imbalances throughout the body, including musculoskeletal, vascular, nervous, urogenital, respiratory, digestive, eliminatory, neuroendocrine, and lymphatic dysfunction. So it can help a ton of things.
Yeah, a lot of different things.
So much.
And I think we get a lot of questions of what are we helping or what is the result of this? And I think the simple answer is that it's widespread.
Yes, yeah. And it's rare that whatever we're treating is exactly what the patient is struggling with, which is the initial case that we're going to start with, and just kind of share some of our experience with it and help kind of guide through some definitions and stuff along the way.
Yeah, absolutely. So we'll dive into it. We're just going to be chatting about some patient cases that we've had that really demonstrate how incredible this work really is and the impact that it can have in our population, but just in people in general. So the patient I'm going to start with, mid-20s, female, originally came to us because of foot pain. You're seeing a physical therapist because of some foot pain that you've been having. Hers had been going on for a good amount of time. So I think we were looking at probably more than 4 years or so, in a long history of seeing orthopedic surgeons, podiatrists, other physical therapists, so many different professionals. She had been booted at one point, which didn't help. She'd been given inserts at one point, which didn't help. She had tried numerous different types of footwear, various forms of imaging. And so when she comes into our clinic, I think one of the amazing things that we do is we really assess the whole body, the whole individual. So obviously we're reviewing that history, but with our inclination of going towards that visceral manipulation or that mindset, I asked, we start to ask questions like, well, what is your digestion like? Found out that she's dealt with a lot of chronic digestion issues, in addition to constipation. So it's like, okay, that's interesting, right? So you start to consider how that impacts the body or what type of things result in constipation.
Most people haven't been asked that question before. It's
totally.
Not really you're not going to go to your podiatrist and necessarily be asked what your bowel movements are. So.
Yeah, exactly. Yeah. And so in the evaluation of her body, basically kind of pointing towards some tension being held in the front of her left pelvis. Obviously, she's here to see me for some ortho treatment. So I go to evaluate the foot as well, doing our typical manual assessment of the foot, the different bones of the foot, the ankle joint, that whole complex, the Achilles, the calf, so on and so forth. And I'm not finding anything that's really sticking out to me, right? Usually with someone, or not usually, but it's very often that someone might have something going on with the foot, but I'm like, things are feeling pretty dang good.
And maybe because some of her prior treatment had actually helped that piece of
foot
it.
mobility for sure, or ankle mobility. But so part of our assessment also will evaluate blood flow to different structures. So out of curiosity, I just went and checked her posterior tibialis pulse, both ankles, right, post-tib, and dorsalis pedis as well. Dorsalis pedis was fine, so that's right on the top of the foot. Posterior tib is right on the inside of the ankle. And so again, trying to see if I can make a connection to that constipation, because we know with our study of anatomy that blood flow to the legs can absolutely be affected by something more proximal.
Just something more central in the abdomen, yeah.
Exactly. So her pulse was diminished on that left side, right, which is, and it is her left ankle. I don't even know if I even said it at the beginning. And so I followed that more proximally. So again, closer up centrally to that tension that I was also picking up on the left side of her hip, finding out that that innominate does not really move posterior. So that's that hip bone wasn't really shifting. So you're really starting to pick up on some of that deeper tension. And then as we're assessing even those internal structures, I'm like, dang, her sigmoid colon is not working or not moving. And so sigmoid colon, you're looking at that very terminal end of the colon before it reaches your rectum, and it sits right in that left hip space. So oftentimes individuals that have struggled with a lot of constipation will have a restriction in that tissue or this tissue around there.
Hip flexor, glutes, all that stuff.
Exactly.
Yeah.
And those structures lie very close to or on top of all those important blood vessels that feed the leg and down into the foot. So I asked her to trust me. I was like, we're going to treat up at your sigmoid colon around your pelvis. Worked a lot of the mesocolon that surrounds that organ. So what kind of keeps that suspended basically. And worked a lot of those kind of surrounding structures basically. Got that innominate to move a little bit more. So resulted in a little bit more hip mobility, which was awesome. And then you finish by going back and retesting the pulse on the ankle, and it had actually improved. So some really cool changes there.
Did she have vascular symptoms like cold feet or anything like that?
No, not that she like really talked about or pointed out from the beginning. And then come follow-up, right? So that's all the eval. Come follow-up, which we do 2 weeks after eval at our clinic. Ask her, obviously, how have your symptoms been? And she has had no foot pain. No foot pain since the eval. And this is someone that was having like waking up with that pain every single day, walking around with that pain every single day. And so for 2 weeks, not having any of that. And then of course she comes in for that assessment, that reassessment. We just get to continue that work. So just really amazing the impact.
We love weirding people out with that stuff.
It does take a lot of trust and communication. It's like you gotta kind of go with us here and just let's see what happens. So
a lot of anatomy education and just like visually showing patients how everything is connected in the body and how the way that we assess the body. So you'll see us we like visually show what we're doing. So do you mind explaining kind of what you were feeling just so people know why we're doing this weird thing with our hands?
So our evaluation techniques, that's kind of what you're trying to get at, right? We call it listening basically, right? So it's our ability to like use our hand. What will happen is when you go over areas where there's been some level of dysfunction present, whether it's inflammation or some type of restriction in the tissue, if there's not enough or if there's a deficit in blood flow to the area or how things are working, you basically will feel like a pulling sensation to that area. So that's like what we do in that initial evaluation. So that's how I got over to the sigmoid. And then when you start to evaluate the sigmoid more, you're realizing, okay, you're now testing different planes of mobility. Is it able to rotate or externally rotate or internally rotate? Will it move superior, exterior? Where is it stuck? Where is that tissue not budging? And that's really kind of how we get started with that. Yeah.
And it's really interesting too. I have a scar on my arm that I'll show patients too. You can play, because obviously our hands have been trained to feel for this sensation. So you might not feel it right away. But if you want to play with it, if you take kind of the area of your palm underneath your thumb, you can feel over an area that has a scar and that doesn't. And because of the basically the charges of the liquid flowing in there, you're going to feel either an attraction or nothing at all. And so that's kind of the best way to describe it. If you guys are interested in learning more about that, Dr. Jared Pollock talks about the fourth phase of water, and he's starting to just have some really cool science behind what we're feeling. But
it's
kind of like, I always butcher this word, a sommelier. sommeliers' tongue, how they can take a sip of wine and know exactly where the wine is from and what year. And
I would be able to say that word better than you.
Okay.
So. Sommelier, something like that.
Sommelier, maybe.
The wine professionals.
You know what we mean. Yeah. So, okay.
Cool.
So when she came back, foot pain was gone.
Yeah. Still had a restriction. The sigmoid was definitely better than it was at the eval. But the other really cool thing was she had had better bowel movements even since the eval too. So again, we're always looking at that. What's the whole picture look like? What is the whole system? How is the whole system functioning? Or how are symptoms functioning together, basically?
Yeah. And sometimes, again, like people don't know that their bowels are off until they're like, oh, this is like really, really good. So
totally.
That's awesome.
Yeah. So I'm excited to keep working with her. I'm excited to see where this goes.
Yeah.
Yeah.
Awesome. So the patient situation that I was going to walk through is a really interesting case actually that you evaluated. So she had her main reason for coming to see us is she's been constipated her whole life, like relatively dependent on a lot of supplements to help her bowels go. And she was just looking for some support, something. I can't even remember if I feel like she had done a bunch of testing and that kind of stuff to see if there was, toxins and all of that in there. And she just still was very dependent. And I think a lot of patients that we see that are dependent on supplements, sometimes it's just that fear of getting off because you feel so bad when you don't have a bowel movement.
Yeah.
So I think I saw her, maybe her third visit, and it was interesting. So when we do the initial evaluation of a patient, we feel the top of the head first.
Yeah.
So what this does, similar to what we were talking about with the scar, is it tells us where in the body the biggest restriction is that day. So it helps us to not follow the symptom, but follow where is the main area that we can work on to make the biggest change today. And so when I evaluated her, it was posterior, like to the backside, left below the diaphragm, but it was the kind of a sway. And so when we're in our training, this sway can share with us that there's a little bit more of an emotional restriction rather than just a physical tension in the organ. So when we experience stress or an event in our life, our organs are meant to be reservoirs to kind of help store and then transport emotions through the body. And so if they get overloaded or store for too long, it can create physical tension. So that's kind of what we're looking at. And so when I felt, just based on Ariana's notes, I went and checked the movement of her large intestine and small intestine at the start of the treatment. And her large intestine, like literally was not moving at all. It was insane. So if we look at, I think this is going to be the same side. So this is the right side. The large intestine comes up and makes a U shape here. So splitting it in half, the right side was moving about 20%. The left side was moving not at all. So this descending colon had zero movement.
Yeah.
So another way that we can confirm when we're doing treatment, if it's emotional or if I need to get in and work like a physical restriction of the colon, is through heat. So I just used a little bit of heat evaluation, and it was large intestine was the main area of the emotional kind of listening.
Yeah. When you mean heat, like, I mean, it literally emanates from the region where there's like an emotional relationship, basically, or some type of emotional involvement. I know I was trying to explain that to a patient the other day, like how like we can pick up on such small changes in that heat that can basically is coming off of the abdomen or coming off the body in different areas. It's pretty amazing.
It's pretty cool.
Yeah.
And it's again trained hand. You have to be able to feel it. And typically the heat could be a metabolic, like an inflammation as well. So we can go and confirm that it's emotional through some stuff with the head as well.
Yeah, where the limbic system is. Yeah, exactly.
So, and had you guys had any emotional discussion? I don't think you had any emotional listenings yet.
I don't think on that.
Yeah.
During the eval. I
Yeah.
don't think so.
So Ariana had worked through some of that physical tension. And so I talked to the patient, this is a new concept for a lot of people. So explaining like, I'm going to be doing some work at your head. We're going to work on the limbic system, which is where we store a lot of emotions and events and that kind of stuff. And I'm not reading your mind. That's what I tell patients all the time. I can't read your mind. And if I ever can, I might stop doing this work because that sounds terrifying. And so basically what I do is I have my hand over the limbic system in the head, and it's a reintroduction of the brain to that organ. And so it's hey, you're still a part of my body. Let's reconnect again so we can help diffuse, get rid of, process some of these emotions and let it go.
Yeah.
And so I talked her through that and shared a lot of times that the intestine stuff can be related to family stuff, and never with the intention of trying to be a therapist and talk through stuff, but sharing that with patients can help them be like, oh, I do relate to that, or I can help process this.
It's like a lot of like overprotectiveness almost of the family, right? Yeah. It's really interesting.
Yep. And so she didn't share any more details about that, but shared that she resonated with it. And she was crying during the treatment. I went and checked I made sure she was okay and talked her through the situation.
Don't ignore the tears.
Yeah, don't ignore the tears. But when I went back and assessed the large intestine, that movement on the left side was about 40%, and the right side had improved as well.
That's pretty amazing.
So it was really cool. There was no manual from like a movement of the colon treatment in that moment. It was just helping the brain release some of those stored emotions.
I feel like a lot of people can relate to that, even when you just think about how when we go through really emotional situations, whether like no matter what it is, if it's a stressful event, if it's a traumatic event, if it's whatever it is, we are like trained in our culture to dissociate from those feelings, from those emotions, because it's scary a lot of times. And people don't always realize that has an impact on your body. Just like how you would dissociate from a certain emotion, you might start to dissociate from a certain part of your body. And it creates that imbalance between those systems.
And it's kind of like a saving face thing. You don't want to, like, we have to rally through. I think even in our work, oftentimes we have to stuff emotions in the moment.
Totally.
So learning how to process that and just talk, like when a patient goes through an experience like that, hey, have you been to a therapist before? Do you have skills that if emotions do come up over the next couple of days that you can journal or talk to someone or
have some tools?
Try not to stuff it back down. So that was just a really cool, I haven't seen her since then. So we'll see how bowel movements are, but just to be able to see that big of a change in
pretty amazing.
That just general rhythm of the large intestine, which is going to help those bowel movements. So it's very cool.
Very, very cool.
Yeah.
The body is complex and it's so beautiful.
Yeah. So it was just a really fun, I think those two examples are just really cool, big changes that we'll see. It's not always big changes like that right away. But we always have to go back to our hand and what we evaluate, and maybe we're not the final step in that person's healing journey, but oftentimes because they've seen so many providers, their body has been really well prepped from nutrition, supplements, testing, orthopedic. Sometimes we get to be that like last little bit that their body needs. So
for sure.
Fun. Yeah,
absolutely.
Yeah. So if you've got something funky going on, please seek us out, or we can help you find a visceral manipulation provider near you. We're obsessed and
absolutely
excited to keep talking about
more stories. More things.
Yeah.
It'd be so much fun.
Yes. Please let us know if you have any questions or anything specific that you want us to chat about.
Yeah. Thank you for listening.
Yeah.
Listening to us nerd out.
Yeah. We will see you later.
Until next time.